Good evening, everyone, and welcome to today's wonderful session. I hope you're all ready. You solved the paper and ready for a discussion. Just give me 2 minutes time. I have a little trouble in sharing my PowerPoint screen. I'll just set it up and then join the discussion. Just please stay online. Great. I hope I'm audible, visible to everyone. Let's make the great beginning with anatomy, today's full-scale grand test. Hope everyone is preparing with all that high levels of energy which are required whenever you are reading something. If we are depressed, depression leads to dementia, forgetfulness. So don't be depressed. Don't worry that will I remember all these things in the tomorrow's exam or not. Automatically you will remember everything, let me tell you. So let's make the great beginning, doctor. What is the commonest site for the implantation, ectopic implantation? It is the ampulla of the uterine tube is what you need to remember. Ashadul SK. Very good. Thanks for joining the session. Keep punching your answers, doctor. That will be very interesting. What is the safety muscle of the tongue? Genioglossus. Genioglossus is a fan-shaped muscle and is called safety muscle of the tongue. And all the muscles are supplied with the hypoglossal except one muscle. What is that muscle, doc? Palatoglossus, which is supplied by the pharyngeal plexus, is what you need to remember. Pharyngeal plexus. Musculocutaneous nerve. From where does it originate? So you should know where is the musculocutaneous is typically located. From where is it originating? Musculocutaneous, radial, ulnar, all these are the favorite topics of the examiner. It originates from the lateral cord of the brachial plexus. So what are the branches of the brachial plexus is a favorite area of the examiner. Good to see Maunika, Chinni and many more who are all online. Thank you for joining the session. But once more, I want to tell you all, doctor, please download the Incus learning app. And in the Incus learning app, you have 40 full-scale grand tests. Every day, 100 MCQ tests, which is full-scale. Morning, it gets published. When you wake up in the morning, solve the paper of the day. And in the evening, join for the discussion. And identify 10 to 20 topics every day. That is a most important secret. You should keep improving. You should identify what are those 10, 20 topics where my mistakes are all frequently happening. And then you need to resolve that. That's the only secret. So dorsal scapular nerve to serratus anterior and muscular branches of the three scalene muscles typically are the branches of the roots. Suprascapular and subclavius nerve branches from the trunk. And the medial cord branches, you can't forget. M4U. M for medial head of the median nerve, medial pectoral nerve, ulnar nerve, medial cutaneous nerve of the forearm, and medial cutaneous nerve of the arm are the branches of the medial cord. Then LML respa. L for lateral pectoral nerve, lateral head of the median, musculocutaneous, they all come from the lateral cord. Then posterior cord, it is the thickest one. You can remember RADS, radial, axillary, thoracodorsal nerve to latissimus dorsi, and subscapular. They're all considered to be the branches of the posterior cord is what you need to remember. Whenever there is any fracture of the surgical neck of the humerus, whenever there is any fracture, what does it lead to? It leads to the loss of the abduction. Why? It is the axillary nerve injury. Whenever there is any surgical neck of the humerus injury, it leads to the development of loss of abduction is what you need to remember. So what are the muscles supplied by the axillary nerve, doc? Deltoid teres minor, deltoid and teres minor. And because of this weakness of abduction, normally we have a loss of roundness of our shoulder. That contour is lost. So always abduction of shoulder, one of the favorite questions of the examiner. Up to 15 degrees, it is by the supraspinatus. 15 to 90 degrees, it is the deltoid. Beyond 90 degrees, it is by the serratus anterior. Whenever you raise both the hands and say, Govinda, Govinda, it is serratus anterior. Right? Now, fracture of neck of fibula produces the foot drop. Why? What is the nerve which is being injured? Is one of the important questions. So, it is the injury of the common peroneal nerve. The common peroneal nerve is the one which is being enjoyed. So you should remember, Meralgia paresthetica, it is a lateral cutaneous nerve of the thigh. Anterior tarsal tunnel syndrome, deep peroneal nerve. Tarsal tunnel syndrome, tibial nerve. Jogger's foot, medial plantar nerve. Hip pointer, iliac crest. Tennis leg, gastrocnemius and soleus strain is what you need to remember. Now, doctor, give me your answer. Quick quiz question. Great hilar dance on fluoroscopy. Which condition do you see? Come on. Rifa Riaz, Maunika, Asadul. Come on. Punch your answer, doc. Great hilar dance on the fluoroscopy. Where do you see? Punch your answers. Yes. Where do you see the great hilar dance, doctor? Yes. Yeah. I'm waiting for your answer. I'm waiting for your answer. Yes. Where do you see great hilar dance on fluoroscopy? Which condition? Which cardiac condition? Come on, punch your answers. ASD, atrial septal defect. So once there is atrial septal defect, doctor, from the left to right, there is an increased blood flow. From the right atrium to right ventricle, and that increases the pulmonary blood flow. And that is the reason if you happen to take the X-ray, the pulmonary plethora that ASD lead to will typically cause the hilar dance is what you need to remember. Permeability of the water. Which part of the glomerulus, doctor? Once more, this is a favorite question of the examiner. Very commonly asked in the entrance. Without a question on nephron physiology, there is no question paper. You should remember, there is no question paper. So, it is the thin descending limb of loop of Henle. So you should remember, which segments of the nephron are high, impermeable, and which segments are permeable. The thin ascending limb of loop of Henle, thick ascending limb of loop of Henle, and initial part of the distal tubule, they're all impermeable to the water. So you should know, water ascends like a fountain because it is not reabsorbed. That's the easy way to remember. Because both the thin ascending and thick ascending limb of loop of Henle, both of them, they are impermeable to the water. So this is the descending, this is the ascending. The ascending limb, it is impermeable to water, it is not reabsorbed. Because it is not reabsorbed, it will rise like a fountain. That is the easy way to remember. What are the impermeable segments of water? Thin ascending limb of loop of Henle and thick ascending limb of loop of Henle is what you need to remember. In the distal convoluted tubule, sodium absorption, how does it happen? It is the aldosterone secretion that lead to the sodium reabsorption in the distal convoluted tubule. Abhi aa gaya. See, doctor, I am telling you, March 5th से शुरू करके अप्रैल 15 तक कितने दिन हो गया? 40 दिन है. 40 days into 100 most probable questions. A lot of them will be direct repeats also. No wonder. Paper out. 4000 MCQs का चर्चा होगा रोज शाम को 6 बजे को डॉक्टर मुरली भरद्वाज के साथ. कभी कभी मैं डिले हुआ तो 7 o'clock I'll sit with you, but definitely 6 or 7 definitely we will have a session. So every day 100 MCQs. आप सुबह उठते ही before you go to reading room, while you are brushing the teeth, take the Incus app. Incus app को डाउनलोड करो, आपके दोस्तों को भी डाउनलोड करने के लिए बोलो. वहां 40 फुल स्केल ग्रैंड टेस्ट का पैकेज रहता है Incus app के ऊपर. So that days, आज का डेट क्या है? फॉर एग्जाम्पल 9th मार्च. So 9th मार्च के नाम में एक ग्रैंड टेस्ट दिखता आपको 100 MCQs का. फटाफट आंसर करो. You are given only 20 seconds time to answer each question. So totally 100 questions, you won't take more than 35 minutes to answer. But identify where are you going wrong. This is the time you should know what are the areas you need to quickly cover. Right, doctor? And evening, 6 o'clock, wherever you are, YouTube open karo. Absolutely free. YouTube open karo. और ये डिस्कशन में शामिल होना. मगर बिफोर कमिंग टू डिस्कशन, आई एम वंस मोर टेलिंग यू, मॉर्निंग ग्रैंड टेस्ट को आंसर करना इनकस ऐप के अंदर. ऐसा रोज कृष्ण और अर्जुन मिलके पढ़ाई करे तो 40 days में 4000 मोस्ट प्रोबेबल क्वेश्चंस रिवीजन हो जाएगा. और you will be knowing every day 10 to 20 topics which you need to strengthen. But what else is required? You don't read anything else in this world to become the topper in the NEET PG. This is the only secret mantra. Past 22 years, I made almost 2 lakh students to become toppers in entrance. They were all preparing like you, sitting before YouTube, live broadcasted interactive session. And the last 40 days, how much you manage the anxiety, tension, all stress, everything you should manage. For that, let me tell you, mere pyare Bharatwasiyon, you have Dr. Murali Bharadwaz with you to hold your hand and walk with you every day and make you to become the toppers in the entrance. Only thing is, after the discussion is over, you need to identify, अच्छा भाई हम nephron physiology में जरा गड़बड़ हो रहे हैं, ये तो शूट शॉट आने वाला टॉपिक बोल के मुरली भारद्वाज ने बोला, तो इसलिए हम जाएंगे और रिवीजन करेंगे. You have 2000 HD videos which are there in the 2000 HD videos are there in the Incus app for the NEET PG. वो पैकेज में भी आप सब्सक्राइब कर लो. और जो भी टॉपिक्स, wherever you are going slow, go back and do the revision. That's all. Every day 5-6 hours preparation is more than enough in the last 40 days. So DNA polymerase 1, it is the one which initiates the new RNA primer, is what you need to remember. So basically, there are a lot of SS binding proteins, single strand binding proteins. They prevent the premature annealing of the double-stranded DNA. Helicase का काम क्या है? It unwinds the double-stranded DNA into single-stranded DNA. Topoisomerase का काम क्या होता है? It releases the torsional strain. It has got a helicase action. It will unwind. It is like Dushashan. जो द्रौपदी का साड़ी निकालेगा, दुशासन के जैसे है topoisomerase. DNA primase, it initiates the synthesis of new RNA primer. DNA polymerase 1, it excises the RNA primer, fills the gaps between Okazaki fragments. DNA polymerase 3, it synthesizes the DNA. And DNA primase is the one which you need to remember. which initiates the synthesis of the new RNA primer, and polymerase 1 is the one which excises the RNA primer, is what you have to understand. Now in the cerebellar cortex, the only output is to the Purkinje cell. Purkinje cells, they send inhibitory projections to the deep cerebellar nuclei. They are the sole output of all motor coordination. And Purkinje cells are also the largest neurons in the human brain. But of all the things, largest means Bed's cells are the largest. Now, one quiz given to you. Antler sign. अगर आप एक deer को देखें तो you can see the horns are all up. So here even these blood vessels are all up, moving up, pulmonary veins. So these are called reverse moustache sign. It is called as. It is typically found whenever there is a redistribution of the pulmonary blood flow. In a case of the congestive heart failure is what you should remember. Flexor withdrawal reflex. Whenever you apply any nociceptive stimulation of the skin, Babinski reflex bolte na, that one. What is a glycosaminoglycan? Heparin, chondroitin sulfate, hyaluronic acid, glycosaminoglycans. Chitin is not a glycosaminoglycan. It is a naturally occurring polymer. Xanthin oxidase. It can be inhibited by allopurinol. It converts xanthin to isoxanthin and it is a anaerobic dehydrogenase. It is the molybdenum which is considered the cofactor, not the zinc. Once more, doctor, let me tell you. Download the Incus app, solve the quiz before coming to discussion. Then this will be very interesting. Otherwise, मैं शताब्दी एक्सप्रेस के लिए दड़ आगे बढ़ूंगा. अगर आप ऑलरेडी सॉल्व करके जरा आपका माइंड इस्तेमाल किया एग्जाम के कंडीशन में Incus ऐप के ऊपर एक टेस्ट किया, then the discussion will be interesting. अभी आ गया शूर शॉर्ट MCQ. एग्जाम हॉल में मुरली भरद्वाज याद आएगा आपको. सेम डिटो क्वेश्चन आएगा कल के एग्जाम में. Which reactions occurs in mitochondria, which occur in cytosol, and both of them? Favorite question. Glycolysis, glycogenolysis, glycogenesis, HMP shunt, fatty acid synthesis, bile acid synthesis, cholesterol synthesis, they all occur in cytosol. Which process occur in mitochondria? Beta oxidation of fatty acids, electron transport chain, Krebs cycle, TCA cycle, and oxidative phosphorylation. Both mitochondria, cytosol, urea, gluconeogenesis, protein synthesis, steroid synthesis, sorting of the proteins in the Golgi bodies, both mitochondria and cytosol. Doctor, after this test is over, this video is made available in the Incus learning app under that particular quiz tournament. I mean that mock test. Even this PowerPoint is also made available for you to do the revision on the Incus app. That's the reason, don't worry. Now, which amino acid makes the major contribution for its ability to absorb the light in the region of 280? Tryptophan. Only amino acids which are aromatic, जिससे सुगंध निकलता है, aromatic, they absorb the light. Tryptophan, tyrosine, phenylalanine, histidine, they only will absorb the light. अभी आ गया फेवरेट क्वेश्चन, इसको राम करे तो 5000 रैंक्स पीछे पड़ जाओगे. Km and Vmax both are altered in which type of inhibition? In case of uncompetitive inhibition. भैया कॉम्पिटिटिव मालूम है, नॉन कॉम्पिटिटिव मालूम है, ये अनकॉम्पिटिटिव क्या होता है? देखो, you applied inhibitor. What type of inhibitor is it? It is a reversible competitive inhibitor. So remember, competitive inhibitor, substrate affinity to the enzyme. हर एक substrate को enzyme के ऊपर it will have a fluctuation, infatuation, affinity that will be lowered by competitive inhibition. Vmax will remain same, but Km become increased in competitive. Non-competitive. So now basically non-competitive. What happens in non-competitive? So doctor, non-competitive में substrate affinity to the enzyme, it is not lowered. So Vmax is increased, Km is unaltered. बराबर? You'll remember, photo ले लिया, बढ़िया. Uncompetitive inhibition. It is also known anti-competitive inhibition. So it takes place when an enzyme inhibitor binds only to the complex which is formed by enzyme and substrate. So uncompetitive inhibition requires enzyme और substrate दोनों शादी होने के बाद. So typically it will cause a decrease of Vmax and also Km. And always uncompetitive inhibition works best when the substrate concentration is high. That's a point you need to appreciate. So for more discussion about enzyme kinetics, doctor, you know very well, Incus ऐप का डाउनलोड करो, 2000 HD वीडियोस का पैकेज में आपको पूरा मिल जाएगा, राइट? सो डोंट कम अलोन, ब्रिंग योर फ्रेंड्स ऑल्सो. उनको बोलो भाई आप कहीं भी पढ़ो मगर डॉक्टर मुरली भरद्वाज का लास्ट 40 डेज डेली, लास्ट 40 डेज डेली फुल स्केल ग्रैंड टेस्ट का YouTube डिस्कशन मिस नहीं होना. फ्री है, फ्री मुफ्त में मिल रहा है, मिलेगा. मुरली भरद्वाज from the beginning is very popular for being a free teacher, but still every day evening 6 o'clock I am available. But before coming, go to the Incus app and take the test and come. So 40 days into 100 MCQs, 4,000 most probable MCQs. Almost from this 4,000, your 200 questions will come. Don't worry. I am leaking you the paper. But you need to identify every day. अच्छा भाई, मैं ये टॉपिक में मिस्टेक किया. Little syndrome, Bartter syndrome में मेरा मिस्टेक हो गया. चलो, let me quickly do the revision. Like that every day 10-15 topics पकड़ो. बस, more than enough. Now, which bacteria produce hemolysis on the blood agar media? Bacillus subtilis, Streptococcus agalactiae, and Pyogenes, not pneumonia. So, what are the very high-yield MCQ in the NEET PG exam, doctor? जिसको ये लिस्ट मालूम नहीं है, वो कल के नीट पीजी में क्लीन बोल्ड हो जाएगा. एक फुटबॉल ले लो, पॉकेट में रखो, रिवीजन करो रीडिंग रूम में. बीटा हेमोलाइसिस, Streptococcus pyogenes, Agalactiae aureus, and Listeria monocytogenes, and Bacillus subtilis, all for hemolysis. Streptococcus pneumoniae. I have a very sensitive keypad here. Kabhi, the moment my hand hits that, immediately it will keep running. Sorry for that. Okay. I'm so happy to see 27 online classmates. Very good. So, alpha hemolysis. Typically, it is shown by Streptococcus pneumoniae, viridans, mutans, sanguis, and enterococcus is what you need to remember. Enteric fever is caused by Salmonella paratyphi. When will you diagnose that? Antibody titer of TO and also TH are raised. A single test of O titer of 1:100 and H titer of 1:200 are considered to be significant. Similarly, fourfold or higher rising titer in an interval of 7 to 10 days is much more meaningful than one test. And for the brucellosis, you use only O-somatic antigen is what you need to remember. Now coming to the polio. Polio is Picorna viridae. It shows interference phenomena and it has a icosahedral symmetry. Now, poliovirus is resistant to the ether is what you need to remember. Which virus can be cultured in different cell culture system? Influenza, HIV, and adenovirus. Then how do you diagnose the Norwalk virus? Immune electron microscopy, antigen detection immune assay, nucleic acid amplification, serum antibody test. That is how you basically make a diagnosis. Now coming to the Cryptococcus neoformans, there are a list of fungi which are called dimorphic fungi, which you need to remember. That is Cryptococcus. That does not include Cryptococcus. Cryptococcus is a monomorphic yeast. Monomorphic yeast. It is a urease positive yeast. It leads to meningitis in AIDS. It is more prevalent in the pygon infested areas. हम तेलंगाना की हैदराबाद वासी हैं. हैदराबाद पाइगन्स के लिए बहुत पॉपुलर है. So Cryptococcus neoformans, which are neurotropic organisms. So Toxoplasma, Naegleria, Plasmodium falciparum, Malmuthia, they are all called neurotropic organisms. अभी मैं आपको पूछ रहा हूं, इसको बोलते हैं भैया गोल्डन एस साइन. कल के नीट पीजी में शूर शॉट आने वाला इमेज बेस्ड एमसीक्यू है. What is it diagnostic of? If you are able to find a shadow like this in the S-shaped margin, it should always raise the suspicion of a central neoplasm. What are the two neoplasms of the lung which are central? Yes, C. Squamous, small cell, both of them are central. Adenocarcinoma is peripheral. That's the point you need to appreciate. Even right upper lobe atelectasis also. Right upper lobe atelectasis collapse. It also can present like a golden S sign is what you need to understand. Now, what are the orphan diseases? They are very rare. Cystic fibrosis, Wilson's disease, familial hypercholesterolemia, which is homozygous. So when small percentage of the population is affected, you call it as orphan's disease. Now the rarest genetic disease means ribose 5-phosphate isomerase deficiency is rarest. Now, once more doctor, one of the favorite topic, Incus ऐप में भी हमने बहुत गर्मा गर्म डिस्कशन किया in the 2000 HD videos में, without a question on T half, volume of distribution, first order, zero order, kinetics. Then all these pharmacokinetic parameters are there, no, doctor? Maintenance dose, loading dose, how do you calculate? Everything. Bioavailability. 100% गर्मा गर्म रेडी रहना कल के एग्जाम के लिए. एग्जामिनर क्वेश्चन देते ही उसके ऊपर हमला करना, ठीक है? Attack. That's what should be your aggressiveness, not submit to the examiner. So a lot of times when I spoke with a lot of students, one thing I observed, doctor, people have a large size expectations about the NEET PG exam, but actually it is not that tough. Sometimes we find a guy who never read, whom we thought is a useless scrap, turns out to be a topper. And the guy who is obsessively nail-biting, no girlfriend, no boyfriend, same sex, opposite sex, who never enjoyed 1 minute of life also, always reading, awfully, miserably lost the entrance. Why? Because entrance exam is all about the focus, common sense. Not more than 5-6 hours of preparation for 40-50 days. That's more than enough, doctor, let me tell you. I have seen 2 lakh students becoming toppers in the past 22 years. I myself was a topper. You know, to top the entrance exam, first thing is don't defeat yourself by saying, "Arey bhai, my अच्छा नहीं पढ़ा. आप अच्छे हैं. First believe the inner power of yourself. That's most important thing. Then don't regret about yesterday. एक 1 second pass हो गया तो उसको फिर लाना impossible है. Life is a multitude of things, doctor. Pleasant surprises every minute, every day, every hour. We don't know. It's not in our control. But when it is in our control, with the limited time available, if you're not thinly spread, if you have a focus and an end in the mind as to what to read, 5-6 hours, last 40 days is more than enough to become the topper. Take it as my word, right? So with that, don't forget that you're born to be a winner. There is nobody going to stop you from becoming a winner. Provided next 40 days, you hold yourself strongly to the mission of becoming the topper in the tomorrow's NEET PG, right? So that is a promise. So doctor, what factors governing the volume of distribution of a drug? It depends on the fat-lean body mass ratio, amount of plasma protein binding of the drug. If a drug is strongly plasma protein bound, it cannot be able to diffuse into the tissues outside the plasma, and that typically leads to a decreased volume of distribution. Similarly, the pKa value of the drug. So the drugs with high lipid solubility, low rates of ionization, low plasma blinding, they have a higher volume of distribution. And the volume of distribution is also increased by renal failure because of fluid retention, liver failure because of the altered body fluid and plasma protein binding. And it is decreased in dehydration. The volume of distribution is what you need to remember. The beta blocker with additional potassium channel blocking activity, that is sotalol. So potassium channel closers have a hypoglycemic effect. So sulfonylureas, repaglinide, they're all closers of the potassium channel. Potassium channel closers also have antiarrhythmic effect. Amiodarone, sotalol, beryllium, they all are potassium closers, is what you need to remember. Once more, doctor, if you have done this question wrong, immediately you need to jump and do the revision on the Incus app. You have 2000 HD videos for you to do the revision. Churg-Strauss syndrome is reported with Jaffer-Lucas. Now, alpha-1 acid glycoprotein, there are certain drugs which are strongly bound to it. So, this alpha-1 acid glycoprotein levels are affected by pregnancy, certain diseases, particularly HIV. Alpha-1 acid protein is a carrier of positively charged drugs, whereas albumin carries negatively charged acidic drugs, steroids and protease inhibitors. So whenever we are aging, there is a small decrease in the plasma albumin levels. And there is a small increase in alpha-1 acid glycoprotein as we keep aging. Now comes the dirty list to remember. Alpha-1 acid glycoprotein, what drugs are bound? Beta blockers, prazosin, methadone, lidocaine, imipramine, verapamil, bupivacaine, disopyramide, and quinidine is what you need to remember. Which antiretroviral belongs to protease inhibitor? Nelfinavir. So once more, doctor. HIV drug classification, favorite area of the examiner. Nucleoside analog reverse transcriptase inhibitors. They typically are analogs of cytidine, guanosine, thymidine, adenosine. Thymidine analogs are zidovudine and stavudine. Cytidine analogs, lamivudine, emtricitabine. Guanosine analog is abacavir. Adenosine analog is diadenosine and tenofovir, is what you need to remember. Then similarly, you have the nucleotide analog reverse transcriptase inhibitors. So the nucleotide analog reverse transcriptase inhibitors include tenofovir and edifovir. The non-nucleoside reverse transcriptase inhibitors, efavirenz, nevirapine, delavirdin, ripivirin, etc. Protease inhibitors, sakinavir, nelfinavir, indinavir, atazanavir, ridonavir, tipranavir, they're all considered to be the protease inhibitors, is what you should remember. Now, this is one of the favorite questions of the examiner. N-vertide Maraviroc. What is blocked by the N-vertide and what is blocked by the Maraviroc? Come on, punch your answer, doctor. Let me check how good is your preparation going on. Come on, who is going to give me the correct answer? I am waiting for your answer. N-vertide blocks which receptor? Maraviroc blocks which receptor? Who is going to give me the answer? Yes. N-vertide and Maraviroc. Rifa, Riaz, Maunika, Asadul, and many more. Let's make it a bit interactive, doctor. Yes. N-vertide blocks which receptor? Yes. Punch your answer, doctor. I'm waiting for your answers. Which receptor is blocked? Maunika says GP41. Beautiful. Maraviroc. Come on. Maraviroc blocks which receptor? Who is going to give me the answer? Maraviroc blocks which receptor? Come on, come on. So Abhiram is saying fusion inhibitor. Beautiful, doctor. So enfovertide is a fusion inhibitor which blocks the GP41. Very good, very good. That should be the spirit. So all these sessions, doctor, they are supposed to be interactive. GP41 is fusion inhibitor. CCR5 inhibitor, receptor inhibitor is Maraviroc, which blocks the GP120, is what you should remember. Now, type 1 helper cells, they secrete interleukin 2. All these interleukins, doctor, this is another batti marne wala topic hai. Tomorrow's NEET PG, one question on interleukin आएगा, मुरली भरद्वाज आपको याद आएगा. Interleukin 1 cause. So how do you remember? Interleukin 1 cause the fever. Interleukin 2 cause T cell stimulation. Interleukin 3 cause bone marrow stimulation. Bone marrow stimulation. Interleukin 4 cause IgE stimulation. Interleukin 5 IgA stimulation. That's what you need to remember. Now in Addison's disease, what do you see? We see hypotension. And similarly, pigmentation of the skin. Addison's patient is weak, hypotensive. In spite of giving fluids, BP does not increase. Severe muscular weakness, lying on the side of the bed. Whereas the red purple abdominal striae are the feature of Cushing. ये बहुत खुशी है. Cushing's disease. You find all these striae. Similarly, this is a classical location of hyperpigmentation which you see in the case of the Addison's disease. Note the function of liposomes. Liposomes transport the lipoproteins. Liposomes are composed of phosphatidylcholine enriched phospholipids. Russell bodies are seen in case of the multiple myeloma. Typically all that immunoglobulin rich Russell bodies. There is eosinophilic large homogeneous immunoglobulin containing inclusions which are found in the plasma cells is what you should remember. Iron deficiency. In long term, what does it lead to? It leads to erythroid hyperplasia, raised free erythrocyte protoporphyrin. Because protoporphyrin को iron के साथ शादी हुआ तो वो हीन बनेगा. If iron is not there, then erythrocyte protoporphyrin levels will increase. Similarly, iron deficiency will increase the soluble transferrin receptors. So they are all the telltale features of iron deficiency. Megaloblastic anemia, there is an ineffective erythropoiesis. So if you do the bone marrow biopsy, long bizarre shaped megakaryocytes, then increased stainable iron, megaloblastic erythropoiesis, increased cellularity. That is the classical feature of megaloblastic anemia. So tomorrow, NEET PG exam में this image-based MCQ of this megaloblastic bone marrow का picture देने वाला है examiner. आप बोलेगा क्या बोलेगा? भाई हमको मालूम है ये. हम आखिर कौन हैं? डॉक्टर मुरली भरद्वाज के साथ 40 दिन रोज चाय पी के हम 420 बन गए. Right? So that's what you should tell the examiner. You should attack the examiner in the exam hall. Don't submit. So now, the time for exhumation in India कभी भी कर सकते. No time limit. What is the best site for collection of the blood in toxicological analysis? Heart. Blood from the heart. So that is the good source of toxicological analysis. Like an ink, will lead to arborescent burn, the lightening. Tomorrow, NEET PG May, this is going to be an image-based MCQ. Murali Bharadwaz will come to your memory in the exam hall. Definitely आएगा. इनको बोलेगा Lichtenberg's fluorescent burns. It is due to the rupture of the small blood vessels due to the lightening, which lead to this kind of a arborescent burns. Towel burns, electricity burns. Flash burns or high voltage electric burns. Now आ गया गर्मा गर्म MCQ. Sexual perversion, lesbianism, pedophilia, transvestism, they're all considered to be sexual perversions. Good to see Anil Joshi and many more who are all online. So sexual offenses are divided into three types: sexual perversions, unnatural sexual offenses, and natural sexual offenses. By perversion क्या होता है? Without intercourse only, complete satisfaction, happy ending is called sexual perversion. Sadism, masochism, sadism by inflicting injury to others, masochism to get inflicted by others, fetishism, exhibitionism, transvestism, voyeurism, looking through the peep, small hole, frotteurism, tribalism, lesbianism, sodomy, bestiality, etc. They're all sexual perversions. There is no intercourse involved. Then you have natural sexual offenses, incest, rape, and adultery. Then unnatural sexual offenses means there is a penetration, voluntary sexual intercourse against the order of the nature. Fellatio, oral stimulation of the penis. Cunnilingus, oral stimulation of the female genitalia. Sodomy, buggery, gerontophilia, etc., etc. Once more, doctor. Semen analysis, sexual offenses. Definitely one question on IPC. जरूर आने वाला topics है. So you have to be 100% sure. Similarly, drowning, asphyxial deaths. So there are totally 950 high-yield topics, doctor. They're all there in the Incus learning app in the form of 2000 HD videos. Each video is about 15 to 20 minutes video. 2000 HD videos where 950 high-yield topics are being done the revision. So please take every opportunity. Solve daily grand test and go back to the 2000 HD videos to do the revision of the topics that you identify. What are your weak areas? Not only solving test in the morning on the Incus app, evening 6 p.m. join the discussion to know where are you going wrong. Hemodialysis, what are all the list of poisons? Typically, if a substance if it need to be dialysable, it should have a low molecular mass, high water solubility, low protein binding, prolonged elimination, small volume of distribution. They're all the important features. Ethylene glycol, procainamide, methanol, isopropyl alcohol, lithium, bromide, sotalol, ethanol, theophylline, salicylate, acetone, they're all dialysable. What is the corrected effective temperature in the comfortable zone? 25 to 27 degrees. This is one question I used to hate right from my MBBS days. Still for examination, for the entrance purpose, yeah. Similarly, P4SR, 4-hour value also, sweat rate. Comfort zone 1 to 3 liters, just tolerable 3.4 to 5. Intolerable is more than 4.5 liters. If you are sweating like a pig, you can't live. How many IFA tablets? Totally 100. An adult tablet of IFA contains 100 milligram elemental iron, 500 microgram folic acid. A pediatric tablet is 20 milligram elemental iron, 100 microgram folic acid. Adult tablet should be given 100 days minimum in pregnancy, and pediatric tablet is given 100 days minimum every year till 5th year of the child. ये है iron के मामला. You have to batti maro. There is no other way. Millennium Developmental Goals to reduce child mortality. So typically, goal 4 is reduce child mortality, reduced by 2/3 between 1990 to 2015. So under 5 mortality, infant mortality, and proportion of 1-year-old children immunized against measles. They are the indicators of the child mortality control. To reduce the maternal mortality by 3/4 was the goal, target 6. Now, the term social medicine, once more I want to tell you, doctor, there are totally 80 videos of 20-minute duration. HD videos are available in the Incus app. They give you more than enough, everything that you need about preventive and social medicine to get there. It was first introduced by Jules Guarin. In 1848, introduced the term social medicine. Alfred Grodzan said social pathology. René Sand said, founded the Belgian Social Medicine Association. A 35-year-old man, known case of multibacillary leprosy, presented with 2 plantar ulcers. It's an example of secondary impairment. भैया primary disability होता है paraplegia. Secondary होता है because of the primary disability, whatever the lesions develop because of that are called secondary disability. So polio is primary disability, but joint contracture due to immobility in poliomyelitis is secondary disability. Now ESR value is being given to you. Some values are given. What is the standard deviation of these values? कितना values हो गया totally? 2, 4, 4, 4, 5, 5, 7, 9. 1, 2, 3, 4, 5, 6, 7, 8 values are there. So how do you calculate standard deviation? First add all these values, divide by 8 will give you the average. So from every value you subtract that average. 2 minus 5. 2 minus 5 whole square. 4 minus 5 whole square. 7 minus 5 whole square. So you got some values. You add all those values divided by 8, uska square root ले लो, वो हो गया. 2 is the answer. हमने 15 hours में पूरा बायोस्टैटिस्टिक्स का गर्मा गर्म रिवीजन करके इनका साथ में छोड़ दिया. आप रिवीजन करना. Adverse events following the immunization. All adverse events with immunization need to be reported immediately. So what are the various adverse reactions expected? So measles, febrile seizures, thrombocytopenia, anaphylaxis, DTP, prolonged crying and seizures, OPV, vaccine-associated paralytic polio. So they all need to be reported. Now, which vaccine can be reused on the next day? Oral polio vaccine, if you properly store it, you can report it, you can reuse it on next day. Attrition is the problem in cohort study, not case control. Positive predictive value depends on the incidence. is not dependent on incidence. It is dependent on sensitivity, specificity, and prevalence. Sensitivity, so you should know this formula, doctor. So many times this question was asked dearly by the examiner. Positive predictive value. Sensitivity into prevalence divided by sensitivity into prevalence plus 1 minus specificity into 1 minus prevalence. Will you remember this for me? Yeah. Which opportunistic infection you see in immunocompromised people? Toxoplasma, tuberculosis, and HSV. Health education. It is a knowledge and skill actively acquired. It makes people think for themselves. It appeals for the reason. They're all true. So you should know health education versus health propaganda. What are the differences? I leave the literature for you to do the revision. Right, Doc? Now, Abhikam, we will take a 5 minutes break. Go to the kitchen, have a cup of tea, and rejoin after 5 minutes. Okay? So, we'll all meet once more after 5 minutes. We will finish all the 100 questions every day. So that is our goal, right? So see you all after 5 minutes. Please rejoin the broadcast. So, welcome back to the discussion, Doctor. Renal stone is a adverse effect of which anti-epileptic drug? Topiramate. Topiramate. Topiramate is used to treat the children and adults in the case of the Lennox-Gastaut syndrome. It is also used for the prevention of the migraine. And topiramate can also cause acute myopia, secondary angle closure glaucoma in a small subset of people. And it also inhibits carbonic anhydrase, hence it can lead to metabolic acidosis, is another important adverse effect to be remembered. Now once more, tissue plasminogen activator. What are the contraindications? Sure, short MCQ in the tomorrow's NEET PG. Definitely aane wala hai. Take a photo, remember it for exam. Any sustained BP more than 150, platelets less than 1 lakh or hematocrit less than 25, use of heparin within 48 hours, prolonged PTT, prior stroke or head injury within 3 months, 3 months. Similarly, major surgery in the preceding 14 days, minor stroke syndrome, GIT bleeding in the preceding 21 days, recent MI, anything is a contraindication for the recombinant tissue plasminogen activator. Lateral medullary syndrome. What is accept about it? So basically, if you look at the medulla, some tracts are lateral, some tracts are medial to in the medulla. And some of the tracts are decussating, not yet decussated, etc. If you know that, you know the answer. So the impaired pain and thermal sense or the half of the body is contralateral because spinothalamic tract is already decussated in the spinal cord itself. So when you reach medulla, whatever the lateral spinothalamic tract passing through the lateral medulla belongs to the opposite side. So it is the contralateral side of the lesion. There is the impaired pain and temperature. Once more, doctor. Brain stem syndromes is the favorite topic of the examiner. Brain stem syndromes. You have to be 100% sure. So, Weber's or clot, where do you see third nerve palsy with contralateral ataxia in the case of the clot syndrome? So in clot syndrome, because of the oculomotor palsy, there is a ptosis. Because oculomotor nerve supplies levator palpebrae superioris, which elevates your eyelid. And once that is injured, you get the ptosis. And on the opposite side, contralaterally, you are having ataxia. So oculomotor nerve palsy, contralateral hemiparesis, contralateral ataxia, contralateral hemiplegia of the lower face, tongue and shoulder, that constitutes the clot syndrome. And what are the cause of the clot syndrome, doc? Midbrain and the branch of the posterior artery occlusion lead to midbrain infarction leading to clot. And why do you get ataxia? Because there is an infarction of red nucleus, cerebral peduncle, etc., etc. So it is the dentatorubral fibers. So in the cerebellum, you are having the red nucleus, you are having the dentate nucleus. That and the red nucleus near midbrain, they both are connected by dentatorubral fibers. So the cerebellum gets all information from the spinal cord. and all that information it passes to the red nucleus in the midbrain, and that red nucleus, from there it will go to the sensory cortex. That's how our sensory cortex will be getting an information about all our peripherally क्या हो रहा है शिवाजी महाराज के राज्य में क्या चल रहा है. It will be knowing. So, dentate nucleus to red nucleus to the sensory cortex. That's how the flow. So, the dentatorubral fiber injury lead to contralateral ataxia. Corticospinal tract involvement lead to contralateral hemiparesis. Corticobulbar fibers lead to lower facial muscles, tongue, shoulder, they're all contralateral hemiplegia, and oculomotor nerve involvement lead to ipsilateral oculomotor nerve palsy, and that defines the Claude's syndrome is what you need to remember, which is a cause of reversible dementia. Vasculitis, hypothyroidism, Wernicke's encephalopathy, they're all reversible. And Alzheimer's, Pick's disease, they're all irreversible. Binswanger's disease, dementia with Lewy bodies, Huntington's disease, Creutzfeldt-Jakob, multi-infarct dementia, amyotrophic lateral sclerosis. And these are all the various causes of irreversible form of dementia is what you should remember. There's a lymphocytic pleocytosis but a low glucose concentration. Where do you see? Fungal, listeria, TB, meningitis, etc., etc. But pyogenic will cause low glucose, but neutrophilic pleocytosis, not lymphocytic. Caricomes, acute rheumatic fever. In the early phase, there is a valvulitis. Mitral valve will undergo inflammation, become swollen, and valvulitis. And that lead to development of a mid-diastolic murmur of acute carditis in acute rheumatic fever, which is called Caricomes murmur. Hyperkalemia, once more, take it as my word, sure short question. You keep one book, doctor. In that, you make a note, whatever I say, sure short, sure short. We publish a lot of 3-minute videos like TikTok. Incus app is like TikTok for short videos. You too, while studying, can make a quick notes and post the videos. So, tall T waves, decreased P amplitude, widening of the QRS interval. Typically, they are the features of hyperkalemia. So, first sign always is P, QRS, T. Peak T waves, potassium level of 6 milliequivalents. Prolonged PR interval, potassium is 7. Absent P waves with widened QRS, the moment potassium goes to 8 to 9 milliequivalents per liter is what you should remember. These are all class 3 antiarrhythmic drugs. Beryllium, ibutylide, dofetilide, etc. Whereas flecainide, encainide, propofol, they're all 1C. Lidocaine, mexiletine, phenytoin are all 1B. And typically, 1 minute. Sometimes if my hand touches the keypad, it will run. Sorry for that. 1A, quinidine, procainamide, disopyramide, they're all 1A. Constrictive pericarditis. You find pulsus paradoxus in cardiac tamponade, which is effusive tamponade. Whereas constrictive pathologies of pericarditis do not show pulsus paradoxus. Cardiac tamponade shows. So in constrictive pericarditis, what do you have? Kusumal sign. That is, during inspiration, normally jugular vein is supposed to collapse, it doesn't. Pericardial knock, prominent Y descent. So they're all the features of constrictive pericarditis. So rapid Y descent, pericardial knock, hepatomegaly, ascites, peripheral edema, they're all features of constrictive pericarditis. Cromolyn, mast cell stabilizer. Allergic bronchopulmonary aspergillosis में central bronchiectasis रहता, peripheral नहीं. Asthma रहेगा, eosinophila रहेगा, elevated serum IgE रहेगा. They're all true. But you find central bronchiectasis. So bronchial asthma, pulmonary infiltrates, peripheral eosinophilia, serum precipitants, elevated IgE, central bronchiectasis, they're all main diagnostic features of the ABPA. HIV infection में होता है focal segmental glomerulosclerosis. It's also called collapsing glomerulopathy. In Barter's syndrome, what do you get? You get hypokalemia, metabolic alkalosis, nephrocalcinosis. So Barter versus Liddle versus Gittelman, one of these three. Sure, short MCQ in the tomorrow's exam, doctor, medicine mein. Once more, go back to Incus app. You have 2000 HD videos. In that, one of the video, Barter, Liddle, Gittelman. Please pick it up and do the revision. Barter होता है problem in thick ascending limb of loop of Henle. Because of that, there is a hypokalemia, metabolic alkalosis, normal to low blood pressure. And patients have hypercalciuria, nephrocalcinosis, etc., etc. 32-year-old patient with fever, sore throat and rash after amoxicillin. What is the organism? It is the Epstein-Barr virus. Infectious mononucleosis, maculopapular rash is found in infectious mononucleosis to whom you have given ampicillin. Immunocompromised patient develops this kind of a rash. It is like the dew drops on the rose petal, chickenpox, pleomorphic rash, chickenpox. And chickenpox can cause pneumonia. That's what you need to remember. So varicella is also called chickenpox. 70-year-old male, fever, pain in the knee, and 2 lakh leukocytes, glucose of 20, no crystals. What is the next important step? You need to always, monoarthritis in a young adult is, unless proven otherwise, a gonococcal arthritis and also septic arthritis is possible. So gram stain and culture of the joint fluid. So gonococci can cause septic arthritis. 43-year-old male from Kolkata who has diabetes, cardiomyopathy presents with this radiograph. भैया रेडियोग्राफ में आपको क्या दिख रहा है? Pseudogout. Pseudogout is associated with hemochromatosis. And since the patient has history of diabetes, cardiomyopathy, you should always think. 38-year-old from Aurangabad, she says she sleeps poorly, all her joints are hurting. ESR is normal, rheumatoid factor negative, no tenderness over the median third of the clavicle. But there are multiple points of tenderness on the neck. Multiple points, multiple tender points. That is the diagnosis here. Fibromyalgia. So tricyclic antidepressants restore the sleep. Aspirin is not helpful. Biofeedback, exercise, they are partially successful. And what is the important rule? Clavicle, medial malleolus, forehead. They are never the trigger points in fibromyalgia, is what you should remember. ESR is 105. Transient blindness, elderly person, unilateral headache. What else is required? Polymyalgia rheumatica, which is the other end of the spectrum of the giant cell arthritis, is what you should remember. 68-year-old from Vijayawada, symmetrical polyarthritis, splenomegaly, lateral malleoli, ulceration, synovitis of the wrist, shoulder, knee. So, WBC count is 2,500. Rheumatoid factor titer is 1:4,096. What do you expect? So, you should know Felty's syndrome. What is that? Rheumatoid arthritis plus splenomegaly plus leukopenia is Felty's syndrome. A 50-year-old long-standing COPD develops insidious onset of the aching in the distal extremities, particularly in the wrists, bilaterally. 5 kg weight loss. Skin on the wrist is warm and erythematous, bilateral clubbing, and the plain film has been shown to you. What is your answer, doctor? It is hypertrophic osteoarthropathy. Hypertrophic osteoarthropathy, classically. So, typically intrathoracic malignancy. That's the reason you got to obtain a chest X-ray. 32-year-old, you're able to see a cavity. What is a cavity causing pneumonia, doctor? Staphylococcus aureus. 3-day history of fever, shaking, chills, 15 minutes episode of rigor, non-productive cough, anorexia. Chest radiograph, you are able to see the presence of a patch. And WBC is showing increased band forms. So, what is your answer? There is a right middle lobe infiltrate and neutrophilia with band forms. So, typically, it is a case of pneumonia. Community-acquired pneumonia over the age of 35 are commonly Streptococcus pneumoniae, Legionella, and Haemophilus. And the best way to diagnose a pneumococcal pneumonia is by gram-positive diplococci, looking at them. Acromegaly, colonic cancer risk is increased. Hypocalcemia may, you have carpopedal spasm, hyperactive tendon reflex, numbness over circumoral region. They're all true. Insulin is not needed for glucose uptake. Where? In the brain. In the brain. Pramlintide. What happens with pramlintide? Pramlintide suppresses the glucagon secretion and reduces the glucose output from the liver. It is not to be used in gastroparesis because it slows gastric emptying and it reduces the postprandial hyperglycemia. Few people may, fasting blood glucose will be normal, but khane ke baad glucose chadega. So, what are the various non-insulin agents that you use? Metformin, sulfonylureas, meglitinides, glitazones, DPP4 inhibitors. What are injectable non-insulin agents? GLP-1 analogs like exenatide, liraglutide. Amylin analog like pramlintide. So pramlintide decreases the postprandial glucagon, decreases the glucose output from liver. That's the reason it leads to a decreased amount of the postprandial glucose excursions. That's the point you need to remember. SIADH, what happens in this? Typically, it leads to hyponatremia. So whenever inappropriately ADH is produced, means there is no diuresis because it is antidiuretic hormone. No diuresis means plasma volume will increase. So increased plasma volume will stretch the atria. Stretched atria will release atrial natriuretic peptide, and that lead to natriuresis. That is the reason urinary sodium is more than 20. Once more, और एक बार बोलो, SIADH में बोलने के बिना ADH का continuous production हो जाएगा, and because of that there is no diuresis, plasma volume increases, that will stretch the atria, releases atrial natriuretic peptide, that lead to natriuresis, and that increases the urinary sodium excretion is what you need to remember. Proximal muscle wasting is a feature of hypothyroidism, medicines, Cushing's, steroid therapy, etc., etc. Now, this is another sure short MCQ in tomorrow's NEET PG. Without this, there is no paper. ALL के बिना paper नहीं रहेगा. ALL is a common topic for pathology, general medicine, pediatrics, radiology, everywhere. So you should know this list, doctor. I don't know how will you remember. छोटे नन्हे मुन्ने बच्चों, इसका लिस्ट का बट्टी मारो, कल डेफिनेटली आएगा एग्जाम हॉल में. Age less than 1, more than 10, TLC more than 50,000, T922, 411, T814, male sex, hypodiploidy, T411, T814, mediastinal march, CNS disease, bekar prognosis. Good prognosis, T1221, age 1 to 10, TLC less than 50, rapid response to treatment, hyperdiploidy. Now, Danish Dash and the Wager syndrome, you should know the differences. Wager hota hai Wilms tumor, aniridia, genitourinary abnormality, mental retardation. Beckwith-Widman syndrome is hemihypertrophy, macroglossia, visceromegaly. Danish Dash is male pseudohermaphroditism, renal failure, and Wilms tumor. So this is what you need to short remember about Wilms. Transient myeloproliferative disorder is a feature of Down syndrome. Neonates with Down syndrome has a great chance of developing myeloid leukemia. Bhaiya, without a question on developmental milestones, no question paper. Take it as my word. So, doctor, rolling from prone to supine, 24 weeks. Bear creeping, 12 months. Just above the ground, 16 weeks. Aeroplane takeoff leta hai. Chin lift momentarily, 4 weeks. Chin lift persistently, 8 weeks. Shoulder above the ground, 12 weeks. Holds the head above the plane of trunk, 12 weeks. Persistently hold the head in the plane of trunk at 8 weeks. Momentarily, 4 weeks. That is ventral suspension. So, doctor, crawling 9 months, creeping 10 months, bear creeping 12 months, then standing without support 12 months, walking without support 13 months, running typically, all this, climbing upstairs 2 years, everything you should know. Now, once more developmental milestones. Social smile is 6 weeks, doctor. Recognize mother by 12 weeks. Then laughing loudly by 6 weeks. Smiling at his own mirror image, 5 months. Peekaboo, peekaboo, 6 months. Stranger anxiety, 7 months. That is what you need to remember. 15th percentile of head circumference means 15% of children will have head circumference less than that. Eating with the spoon without spilling, to dress and undress herself with supervision, and to understand that she is a girl. So by what age? 2 to 3 years. In beta-thalassemia, myxotic hypochromic anemia, target cells, splenomegaly, they are all the features. It is not hereditary spherocytosis where there is an increased osmotic facility. In thalassemia, osmotic facility of RBC is decreased. Persistent bleeding from the umbilical stump, think of factor 10 deficiency. Late onset hemorrhagic disease of the newborn. You can't late because 4 to 12 weeks of age, intracranial hemorrhage can occur. If you give vitamin K prophylaxis IM, it has a protective value. Hemorrhagic disease of the newborn is more common in the breastfed infants because breast milk is poor of vitamin K, is what you should remember. Heliotrope rash, dermatomyositis. Tinea versicolor affects chest, shoulder, back, not the face. Toxic epidermal necrolysis caused by sulfonamides, aminopenicillins, oxycam, dilantin, barbiturates, enzymes, etc. Leukogenoma can lead to necrolytic migratory erythema is a feature. Hypertrichosis is a feature of minoxidil cyclosporin diazoxide. Cerebral vascular resistance is increased by thiopentone. Oculocardiac reflex is prevented by retrobulbar block, deep anesthesia, atropine, all of them. In porphyria, you cannot use barbiturates. Sympathetoadrenal axis is stimulated by diethyl ether. 50% nitrous oxide, 3 दिन inhalation करे तो भैया megaloblastic bone marrow will develop, one of the important side effects of nitrous oxide. Shanti, Shanti, Shanti. So, doctor, now we finish today's grand test discussion. Once more, Incus app download karo, daily grand test, next 40 days, evening 6 o'clock discussion live. Identify 10 to 15 topics every day. Go back to 2000 HD videos and do the revision. Next 40 days, be with Dr. Murali Bharadwaz. Yatra Yogishwara Krishno Tatra Partho Dhanurdharaha Tatra Sri Vijayodbhutihi, where the chariot called Lord Krishna and the warrior called Arjuna have gone to the battle. Only the success should come. So you are going to become the toppers. Good night.